A mother grapples with consenting to her daughter's risky brain operation. Doctor says, look, I understand this is difficult for you, but your daughter is in a critical condition and we can't afford to. Mother says, what exactly are you trying to say? Doctor says, I'm saying that you need to make a decision very soon. This can't wait until tomorrow. Mother says, I know, but this isn't the kind of decision that you make in a split second on an empty stomach. What if I regret this for the rest of my life? Doctor says, like I said, I'm aware that this is the last thing you want to do. I've told you that her situation is critical and the tumor can only increase in size from here. Without surgery, her chances of regaining consciousness are minimal, but with it, those chances are slightly increased. Mother says, what would you do? Doctor says, I'm sorry, I can't give you anything more than my professional opinion. I've laid out all the facts for you. Mother says, if you operate. Doctor says, if we operate, there still won't be a guarantee that it'll fix anything, but there is a chance it will. And I'm asking now if you will take that chance. And the mother, exasperated, says she's just a child, right? So that's the passage. Now the question is, when the mother asks the doctor, what would you do? Her main intention is to what? Seek advice? B, 100% correct. So that's the answer right there. Now, in regards to section 2, how you answer it depends on who you are. In my classes, there are two types of people. There are people who are good at section 2 and people who are not good at section 2, right? It's a pretty polarizing kind of thing. But the way that you answer questions depends on whether you're naturally good at it or not. If you're not naturally good at section 2, if you got this question wrong, then you've got to learn a method that encourages you to come with a clean slate and use specific evidence in the passage to answer the questions. Because the biggest mistake that people are making is that they ask themselves, what would I do in that situation? Or they react instinctively. And if you're getting it right, then fine. But if you're getting it wrong, you got to change the way you do it. And that's a process of calibration. That takes, specific training. That takes a lot of practice as well, if you're not naturally good at section 2.